How do you find a good Medicare insurance agent? There's at least 40,000 people that are licensed to sell Medicare insurance plans. So how do you decide? I always say go with your gut instinct. If somebody recommends someone to you, that's always a pretty strong, they're happy, check that out. But a lot of people, they don't know anywhere. They don't know where to start. Where do you start this search? Google, start looking around. And why would you work with us versus, the other 20 people that you're looking at? So this is the secret that you don't understand. Here's a whole bunch of different insurance companies. There's just lots of different insurance companies. At the Medicare Family, we're always adding, but we represent over 60 different Medicare insurance companies. We're independent contractors. Now, you could have an agent that only represents Physicians Mutual. Physicians Mutual, they have career agents that they can only sell that product. So I cannot sell you that product. The reason I don't sell it could be many reasons, but number one reason is that I would have to agree to only sell that product and not sell anything else. And there are a lot of agents, we call them career agents or captive agents because they're handcuffed. They have an agreement. They can only sell Mutual of Omaha. They can only sell Blue Cross. They work directly for Humana, and that's all they can sell. So in my opinion, I would never choose one of those agents. I would always want to talk to somebody that represents a variety of insurance companies and can tell me the pluses and the minuses of many different companies that are available where you live. Now, of all these different companies, we don't have a contract with 7 of them. Now, we might get a contract later. Like I said, sometimes we can't have a contract because we're independent. But sometimes we don't want a contract because the company's small and it's just starting and it's not very stable and they don't have a good network or they don't have whatever reason we don't pick them up, but we might pick them up in a couple years. So that's why we keep adding more and more companies. I like to tell people that we work in all 50 states and we typically represent all the large national companies that you've heard of. Mutual of Omaha, Blue Cross, Humana, on and on and on. United Healthcare, Aetna, Cigna, Kaiser, the big names. But the small little companies like Scans only in a few states, or some of these companies like Clover, they're only in a few states. We represent some of those regional companies, but then there's some that we don't, like Pilgrim Health out in Massachusetts. We don't represent them. Now, when you talk to an agent, they are required to tell you, hey, I do not represent all companies in your area. Call 1-800-MEDICARE if you want to see all the companies that are available in your area. That is something that the government just made a new rule that we have to tell you. And I think that's kind of going in the right direction because you don't know what you're even looking for. You don't know to ask people, how many companies do you represent? That is a baseline question you should ask your agent. And they say 3. That's not necessarily a reason to disqualify working with that agent. If it's 3 big companies, it's Aetna, Humana, and United Healthcare, and you're in a big city, and they only represent those 3, it's probably good covering for that city. In general, I would like for them to have at least 5, 6, 7, 10, at least 10 different Medicare insurance companies, Medicare supplements, Medicare Advantage, standalone drug plans, dental, vision, hearing, things for people that are turning 65. You need at least 10 different companies that you represent. Now, agents don't like to talk about that, but as they get older, it's a lot of work to maintain the mental knowledge of all these different companies, and it costs money to pay the fees to represent all these companies, and you have to take tests. You have to take annual certification exams to represent anyone that sells private Medicare Advantage or a Part D drug plan. So for us to do 60 takes hours and hours of annual learning to pass the test to be able to sell 60 companies. There's not many companies that represent a lot of companies. It makes sense, right? It's a lot of work. So a lot of them say we have 5, we have 6, we have 4, we have 2, or we only sell Florida Blue. Florida Blue is a great company. But Florida has a lot of options, and the best one for you might not be Florida Blue. It might be Humana, or Aetna, or Cigna, or Freedom, or Optum, or Simply, or Caremark, or all the, So when you're trying to find an agent, that is a question you should not be afraid to ask, and you should not be afraid to have a discussion about why they don't have more, because there are parts of the country, there's hardly any companies there. So If you have Regents Blue Cross and you're in Upper Idaho, that's fine. There's hardly anybody there. It's a discussion you should have when you're trying to choose an agent, because this is a professional that is going to guide you through your Medicare, your healthcare for the rest of your life. And if you don't have an agent you're comfortable with, give us a call at the Medicare Family. We're here to help. We are licensed in all 50 states. We do not represent every company in your area, but we do represent about 62 right now. Thanks. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.